Transitioning to our next speaker, to borrow a sentiment from my colleague Ken James, we are in the midst of two pandemics, COVID-19 and systemic racism. In our nation and around the globe, communities of color were disproportionately impacted by the coronavirus. We know, however, that racial disparities were not born of the current unprecedented circumstances. Many factors, such as lack of access to testing, pre-existing conditions, status as an essential worker, simply exacerbated them. The story was no different in Michigan. While African Americans represent approximately 14% of the state's population, they accounted for 40% of the deaths from the coronavirus. So the state acted on that and established the Coronavirus Task Force on Racial Disparities to address this. And it was led by our Lieutenant Governor, Lieutenant Governor Garlin Gilchrist, who we are really thrilled to have with us this morning to give us an update on where we stand on that task force, the progress it's making, and also where we stand with the virus. So let's turn it right over to Lieutenant Governor.
All right, good morning, everyone. I want to thank you so much for allowing me to join you this morning. I want to acknowledge my fellow speakers. I know Kristen just left the stage. I also want to acknowledge Todd Anderson from Blue Cross Blue Shield of Michigan, and also Molly Williams from Pfizer. Thank all of you for standing tall, not only for the state of Michigan, but for our entire nation as we come together to play our respective roles in responding to this pandemic. I also just want to thank and acknowledge the fact that our healthcare professionals have been working so hard on the front lines, on the back lines, on every line during this pandemic, and that these women and men are true heroes. And due to your work, Michiganders, as well as Michiganders really taking this virus seriously, we are turning the corner in this pandemic. Even as we continue to watch current case rates, what we've seen is that we've learned what works. And one of the things that we're very proud of and leaning into even more heavily is vaccinations. And we are dramatically increasing our rollout of the 3 safe and effective vaccines that are available to people. And Michigan has really been a leader in the country in working to make sure they are distributed and made accessible equitably. And that last part is really important. I see it as the most important responsibility of my role as the chair of the Michigan Coronavirus Task Force on Racial Disparities, which I am so proud to serve on with our Chief Medical Executive, Dr. Jonae Caldoun, as well as some of the brightest minds in the state of Michigan. Since the beginning of the pandemic, we have seen racial disparities be on full display, whether it's in the midst of COVID, in the midst of the economic downturn as a result of what we had to do to stay safe, in the midst of this generation's call for racial justice and community investment. We in Michigan were one of the first states to actually observe, measure, and report the frankly deadly disparities that we've seen due to COVID. And we took immediate action because we frankly didn't feel like there was a choice. Black Michiganders could not afford for us to wait. Michiganders of color who were disproportionately impacted in terms of contracting the virus and dying from the virus could not afford for us to wait. This couldn't be a normal, regular task force that elected officials appoint that, gets a lot of really smart people together and they have meetings and they come up with ideas that get memorialized in some form of report that may or may not turn into actual policy. We needed to act in real time, because people are getting sick and dying every single day. People are exposed to the virus every single day. So we implemented solutions working with every state department and agency. Literally every state department and agency participates in every one of our task force meetings. And we put in real solutions in real time. We innovated drive-up testing in Michigan, because of course we would invent the way to get a COVID test in your car. We innovated mobile testing, which were specially outfitted vans and vehicles in partnership with Ford Motor Company and community partners that would literally drive testing and public health solutions to a community that was vulnerable. We also said pop-up, walk-up testing sites. And this infrastructure is now being transformed into not only infrastructure to support testing, which was about tracking the virus in our community, but also vaccinations, which is about preventing people from getting sick and having severe outcomes and dying from the virus. Again, this task force is unlike any other we've had in Michigan. We took a fact-based approach to eliminating the virus and the disparities, and Michigan has been nationally recognized for our broader pandemic response. And I believe, and it has been shown numerically, that because we chose to center the experiences of communities of color in Michigan, we have had a stronger state response. We have really seen significant progress on reducing racial disparities that demonstrate that when you focus on a problem as a leader, you can actually help solve it. You heard the stats about Black folks representing 41% of the deaths, and although only 14% of the population in the early parts of the pandemic, that basically translates to Black people being 5 times more likely to die of COVID if they contracted it. But in the most recent available data, Black people account for just 9.1% of the cases and 5.7% of the deaths. We provided grants to community organizations that will help ensure that the improvements for the Black community are sustained by addressing some of the social determinants of health, like food and housing insecurity, access to technology and internet, and increasing flu vaccination and other immunization rates. The task force worked on closing the digital divide when it comes to access to remote and telehealth services, as well as remote and distance learning, something I care very deeply about as a technologist at heart. We launched a Get Covered campaign to make a coordinated push for every Michigander to sign up to get health insurance, recognizing that if you don't have health insurance or don't have a doctor, you're more likely to have poorer health outcomes, regardless of whether you have COVID-19. We've increased our mobile testing infrastructure. That infrastructure is already in place and will be extended for further distribution of health services, like I said, including vaccine administration. We've taken a lot of other actions that were listed in our interim report, but the big takeaway again, and I have to reiterate this on a call with leaders such as yourselves, is that where you focus your attention matters. And where attention and intention is placed, progress can be made. And because of this, and Michiganders taking it seriously, and Michiganders of color taking it seriously, thanks in part to the direct marketing investment that we made to let people know that this was a real problem, we've seen results. These are real actions that we put in place to reduce disparities, and it's just the beginning. As we advance, this task force will continue to identify and recommend both immediate and long-term solutions to address disparities that were caused or exacerbated by this pandemic. So in one sense, I'm reminded of this quote that I used in one of our press conferences earlier last year from Nelson Mandela. And he said that after climbing a great hill, one only finds that there are many more hills to climb. Through vaccination distribution, we are one step closer to re-embracing all of the things that we have missed so much because they were risky during the pandemic. But I also want to acknowledge the fact that there are still some hills to climb in terms of making sure that everyone will make the choice to get vaccinated. I have conversations with my own family, friends, and neighbors about the vaccine, its safetiness and effectiveness, and those conversations are happening all over the state of Michigan. People have questions, and it's important to acknowledge or just say that it's okay to have questions. What's also important to acknowledge in the state very clearly and very plainly is that those questions have answers. And we're doing everything that we can to make sure that people get those answers, they get the information and the resources they need from people and institutions that they trust so they can make this choice. People can get answers to resources from things like the Protect Michigan Commission, which we stood up, and I'm proud to serve as co-chair of that commission alongside Dr. Khaldun and other leaders, diverse leaders really from different walks of life across the state of Michigan. The purpose of this commission, which is our largest and most diverse that our administration has ever assembled, is to ensure that every Michigander from every community in every corner of the state and from every walk of life has the information and resources they need to make the choice to get vaccinated when it is their turn. And we have plans to invest in ensuring that we address and eliminate disparities in vaccine uptake, building upon the work and the learnings of the Racial Disparities Task Force that we have been leading for the previous 11 months. So I want to reaffirm that the governor and I are committed to making sure that every vaccine is distributed equitably. As we've said previously, everyone who wants a COVID-19 vaccine will be able to get one when the time comes, including me. And I'm going to do so publicly again as a relatively young, healthy Black man. I will get vaccinated publicly when it's my turn. As Lieutenant Governor of this great state, I will lead by example and show that all 3 vaccines are safe and effective. This last year, we've shown that when we lead with facts, science, and truth, it is the most important and most effective way for us to decrease hesitancy around anything from COVID-19 testing to coronavirus vaccines. But that said, we have to take great care to make sure that this process is done equitably. And so we've had to be responsive to the specific needs, specific challenges, and specific considerations that different members of different communities have about getting the vaccine. Combating COVID is really personal to me. I've said goodbye to 27 people in my life from this virus. Now is the time to come together in the names of those we've lost, and because so many people, and I'm sure a lot of people who are on this meeting, have also lost many, many people in their lives. We have to encourage everyone to take part in this safe and effective vaccine, because this is part of how we can move forward and build upon those people's legacies. I want every person in our state to get their questions answered so they can get vaccinated. This especially includes our communities of color that have been hit hard by the virus and have historically not trusted large-scale medical interventions. I also want to say that we need to navigate the unfortunate polarized partisan waters that we've seen creep up when it comes to vaccine uptake. It's in this spirit, in the spirit of dealing with all the questions that may exist in different communities, that I worked with my own 83-year-old grandma to get her vaccine. I was able to help her sign up for hers in Oakland County. She lives in Southfield, and accompanied her to the vaccination site there to get her doses. I want to sincerely thank all the people who were at that site, the professionals and the volunteers at the Southfield Pavilion in Oakland County, but also in Vaccinations in the Grand Rapids area and all across the state of Michigan that I've had the pleasure of being able to visit, and thank them for their life-saving service to the community at their respective sites. And I've been proud to see the diversity of Michiganders, both in terms of racial and ethnic identity, in terms of professional background, in terms of health status, just of the whole tapestry of the Michigan community coming together to make the choice to get vaccinated. And I want to thank all of you for being leaders in this community to help navigate these very choppy waters that we've all had to come through together in the last year. But what I know is, again, that focus and intention can lead to the results that we all are striving for. And that is for our community to come through this together, to come through this with equitable opportunity being available to every person in the communities where we live, work, play, and serve. And we can do that by working together to make it so. We can will that into existence. Thank you for your hard work and the selfless actions that you've taken and your team members are taking, because they have without a doubt saved lives. We wouldn't be in the position as we are as a state without our healthcare heroes and those who step up to support them. So thank you all for your time today, and all of you, please continue to stand tall for the great state of Michigan.
What a great message, Lieutenant Governor. Thank you so much for joining us from the Capitol. I know you have to preside over Senate session. Speaking of partisan areas, but you have to preside over Senate session soon. Thank you for your leadership. It's incredible to see the progress we made at trying to eliminate racial disparities in terms of the pandemic here. And I love your message about where you place focus and attention is where you can get results. And if employers want to focus on the issues of diversity, equity, and inclusion, I encourage you to do so, and take a look at this video, some of the services the Grand Rapids Chamber provides to help you do so.
You might not be aware, but we offer a diversity assessment. So when you think about the climate in today's world, you might want to take a look at where I can start a diversity conversation or a diversity journey. In addition to that assessment, we offer implicit bias training, the Institute for Healing Racism, and culture and communication training. I'd be happy to talk with you about these services and how we can meet the needs of your organization. The good thing about the Grand Rapids Chamber is we are nimble and dynamic. We can meet your organization exactly where you're at on your DEI journey, your diversity, equity, inclusion journey, and help you create a roadmap for success. Thank you.
And that is going to do it for our 2021 Healthcare Summit. I'd like to give a big thank you and round of applause to our speakers, sponsors, and attendees. Of course, we're the Chamber, so that means we have upcoming events for you to take part in. We're having a breakfast with legislators on Monday, March 29 at 8 a.m. We're going to meet the new CEO of the Rapid, Deborah Prado, and welcome Senators Winnie Brinks and Roger Victory to talk about housing legislation and a package that our chamber, your chamber, is leading to address that issue. Also, save the date for our West Michigan CEO Summit, which returns on Tuesday, June 22nd, with Michael Davenport of Gyra Metals at the helm as our chair. And we're going to be able to get together in person at some summer golf outings that are just around the corner. Monday, June 7th, the inaugural West Michigan Minority Contractors Golf Outing, and then or Monday, July 19th for the Chamber Open. As a friendly reminder, you're going to receive a survey following today's event. We want you to rate your overall experience, with 1 being the lowest and 10 being the highest for this event. Your feedback is really important to us. We are always in the business of continually improving so we can deliver what you as our members need to help you grow and succeed. So thank you for joining us as we all work together for a strong recovery through great business, great policy, and great leadership. Thank you so much, and make it a great day.